back in business. So today we're going to be talking about hiring a respite provider 101. So this is taken from a PDF that we have here available to you, which I'm going to include it in the email I'm going to send out so that you have all the information. So if you want to take notes during this presentation, you're more than welcome to do so, but I will be sending you a PDF format of all of this information as well. So if you missed something or you need to write something down or whatever, I'll give you all the information in the follow-up email. Okay. So this is going to be pretty direct, straight to the point. And of course, if you have any questions or need me to clarify on anything, or if you yourself have some tips on finding and hiring a respite provider that you think would be beneficial for the group, please do not hesitate to either share that in the chat or unmute and we can have a conversation after I share the information. And so I think the best resource we have is each other sometimes. And so I do want to offer the opportunity at the end to share any information that you may have that will be helpful. So it is 10:01, so let's officially start. So before we begin, this is for informational purposes only, and I will not be encompassing all of the available information on hiring a respite provider today. So again, like I said, if you have tips or information that I don't present today, great, we can share that. Because I know that this is not going to be the end all be all for hiring a respite provider. So if you have any complex legal situations or questions that you might that might come up, I am not your girl to answer those questions. I have a skill set and law stuff is not one. So if you have a qualified attorney that you would be able to talk to about that, that would probably be your best bet. So we're going to talk about today relationship roles between you and your respite provider. We're going to talk about creating a job description, keeping records and like an agreement contract, screening applicants through a telephone, different interview strategies you can use, background checks, locating a respite provider, which is almost like, finding the fountain of youth sometimes, find the right fit. Creating a good work environment. So it's, how do you keep that provider once you find them? How do you train that respite provider? And if you need to terminate that provider, ways that you can go about doing that. Okay. So like I said, this is not going to be an all-encompassing training, but I think it will cover a lot of the basics and at least get you thinking about what kind of person you want to have come in and relieve you of your caregiving duties. So relationship roles. So we need to really be clear about our expectations of the person coming into our space. And oftentimes we are not hiring an agency. We are having someone that we already know and trust, like a friend or a family member, come into our space and provide that respite for us. And so it's very important that we define that relationship before we even move forward. So if you are so defining the relationship just means that you know the responsibilities of that provider and that provider knows responsibilities that are yours, right? Because sometimes you have someone coming in and you don't need them to do everything that you do. You just need them to do a few things. And so it's very important for you to clarify those roles. So if you're using volunteers or hiring somebody to provide respite care services, you are their manager. Okay, so the relationship might be one of friendship or maybe a family member, but first the relationship must be viewed as that of a manager, assistant, or an employee, employer. Okay, so if the provider is going to give quality respite care services, they need to know that it's not just you're not just friends, right? You are, but when it comes to caregiving, when they slide into that respite provision, they need to not see you just as their friend. They need to see you as an employer or an employee or a manager type of deal. Okay. So if they're not clearly defined responsibilities, problems will arise. So it's not a matter of if, but when those problems arise. So the more clear you can be about the expectation about what the job is, the better it's going to be for everybody involved. Next, setting boundaries. That's one of my favorite words. Because it's so helpful for us, because if people know where they stand, what's expected, and then you know where you stand and what they can expect from you, it just makes things so much more free-flowing and smooth. So as part of defining the relationship between the provider and the caregiver, it's important to set the boundaries of the relationship. So think of boundaries as limits to determine what your limits will be. Do you want strictly a business relationship? Do you want a friendship? It may be possible for the relationship to not have the characteristics of both, but it's important to know that the business relationship needs to be primary. Okay, like I was saying, it might be your friend coming in, but once they're on the clock, so to speak, as that respite provider, they need to take that job very seriously. And so most problems will occur when the role of each person is unclear or when the roles change. So part of setting boundaries is dealing with the issue of control. Control is an issue in almost all relationships and is generally defined as managing, overseeing, or being in charge. So the caregiver, which is you, is the manager and must have primary control over the services provided by the respite provider. So control isn't dominating somebody, right? Control just involves managing and overseeing in order to accomplish the goals that you have set for them, okay? So it's important to note that the person in control of a situation must first be able to control your own thoughts, your feelings, and emotions. It's also important in the need for the person in charge to be, it's also important for the person in charge to respond appropriately to situations. Every individual has the right to be treated with courtesy in a humane, dignified manner and to be treated with courtesy. The caregiver, you, is responsible for sharing with the provider your specific expectations in regard to respite care. So you can very much manage the care without having to be a dominating force in that care, okay? Because yes, somebody is coming in to take care of your loved one and is very precious, and there could be a lot of anxiety surrounding that. But you don't want to come off as, you know, an overzealous grumpy bear because that's not going to create a very positive work environment for your respite provider, okay? And another thing to keep in mind is burnout, right? You know probably better than anybody else how susceptible this job is to burnout. It's not an easy job and it can be very, very stressful. So we have to do burnout prevention for our respite providers. So here's some tips that will help prevent burnout and keep you from having to recruit, hire, and train a new respite provider too often, okay? So since most people coming in to give you that respite, most providers are going to be naturally more nurturing and they're going to take on the concerns of others more readily. Encourage your provider to take plenty of time for themselves, right? Just like I encourage you to take time because it is a difficult job. So trying to include some variety in their work and being as flexible as possible within limits, obviously. So that might include taking the loved one, having them take a loved one out of the house for a walk or maybe another activity that they both enjoy. And also have backup providers if possible and use them when necessary. So you don't want to run one person into the ground, right? It's like if I hired a respite provider, I expect you to be here, you know, 12 hours a day, 5 days a week, and also be on call on the weekends, right? You're not doing that. Okay, that is the best way for you to lose your respite provider once you find them. So communicating often with them is a very good idea. Good communication between you and the provider cannot be overemphasized. So if you do that, it will enable both of you to maintain a good working relationship, which is what you want. You want a partnership. You want somebody who is reliable and meets your expectations, but also that, you know, enjoys coming, that knows that you respect them, that you honor their time and that you value their time, okay? So we don't want to burn them out and we don't want to be disrespectful. Next, we're going to talk about getting a job description. Yes, you do need a job description, right? So in order to manage your provider, whether that is a skilled provider through an agency or an unskilled provider through your social networks, it's good to have a job description, especially if you've been taking care of somebody and you know the routine. Nobody else is going to know that. So you have to make sure that they know what you want them to do while you're away, what are necessary priorities that they need to be aware of. So in order to manage a provider, you'll need to look closely at the way that you perform the daily living activities for your loved one. So if you do this, you'll be able to start building a realistic picture of what you need that provider to help you do while you take a break, okay? So you can't just say, well, here's mom, bye, right? Keep in mind, what is it that you're doing during the day? And what can be taken over for you while you're gone, because not everything, they're going to be able to do, and that's okay. But you want to set them up for success, and having those clearly defined expectations is going to be really important. So assessing of your needs will help you locate the right person for the job. Your likes and dislikes and requirements for a provider will help you put together a job description suitable to meet your needs. So some of the reasons that you'll need to create a job description. The process of creating a job description will help you develop a realistic view of your needs and give you a basis for interviewing applicants, right? Do I need somebody just to come in and make sure mom has lunch and a bath? Do I need somebody to come in and do light housekeeping? Do I need someone to come in and entertain my loved one by doing an art project or something like that? Okay. A job description will help you keep the interview focused on job duties. So even if you are hiring a friend or family member, you still need to kind of do an interview process and make sure that they know what you expect and they're willing to perform those tasks. A job description provides a potential provider with clear ideas about what your requirements are for the job. And after the provider is employed, the job description can be used as a checklist of duties and responsibilities. So it helps you keep everything on track. And it's also a good way for you to maintain a healthy boundary with your provider, because then you don't want to get somebody in a situation and they have an expectation of what the job is, and then you switch it on them. Be like, well, actually, I need you to do this too. So a job description just helps keep you accountable as well. Okay. A job description can be a valuable tool when providing feedback for the provider when you wish to evaluate their work performance, right? So that way they can say, well, I didn't know you wanted me to do A, B, and C, right? Well, yes, you do, because it's in our job description, okay? Let's see here. Your expectations can be clarified and remain in focus if you base it on the job description. And a job description can help settle disagreements regarding job duties and responsibilities. So really, a job description is going to serve as a framework for you so that nobody's caught off guard, nobody's blindsided about the responsibilities and the expectations, okay? If you can just think of it from a personal level, if you were hired to do a job and first day of the job, they show up with a whole laundry list of other tasks that you're supposed to do with this job. And you can say, wait, that's not what you hired me for, right? You'd feel a little blindsided, right? Maybe a little taken advantage of. It's the same for a respite provider, okay? You don't want to sneak anything in, right? Next, record keeping and agreement contracts. So accurate record keeping is critical when keeping up with the time a respite worker provides the service for you. Hold on 1 second. So keep in mind that you can set the time you wish to use respite services. The Department of Labor does require that a person working a scheduled amount of time be considered an employee and not a respite care provider. And be aware of the rules for paying a provider. So you can check with the IRS to determine the amount of income paid to ensure you as the employer know your responsibility for paying certain payroll benefits, if appropriate. So providing respite care is not the same as a personal care attendant because it's only temporary care and should not have a consistent time schedule. So it's different if you are hiring a full-time attendant that's going to come in and work 40 hours a week full-time for you. That's usually when the IRS needs to be involved. But since you're just hiring short-term care part-time every once in a while, usually IRS is not going to you're not even going to blip on their radar. So this is just kind of, letting you know that there's a potential there, but it's typically not the situation you're going to find yourself in. So, but the IRS does have forms and publications that can guide you on whether or not you need to file taxes. And the amount you pay a provider annually will dictate what taxes, if any, have to be paid for the provider. Because most caregivers do not use a provider on a regular basis, they will not pay out the amount that would require that they pay any payroll benefits, okay? Again, that's just information that might be applicable to your situation, but usually is not. And an agreement contract between the caregiver and the provider is important as a means to formalize the relationship. And again, clearly identify and indicate the responsibilities of each person involved. The agreement should be flexible, but it should also contain the main responsibilities of the respite care provider as well as the caregiver. As the duties of the provider change, the agreement should be updated, Okay, so especially if you think about somebody who is in a decline, the needs that you have when the respite provider is first hired may change. And so that's when you need to shift that agreement, okay? Because you need to make sure that the person providing that respite is comfortable with the responsibilities. They may have been comfortable with the responsibilities in the beginning, but then if they get more intense and they get, and they change, you need to also make sure that they're still comfortable doing that job. So here's just a sample agreement. And again, this will be in that PDF that I send you, but it just is something very generic that says it is understood that the respite provider will carry out the duties and responsibilities listed in the job description while providing respite services. Both the provider and the caregiver will treat each other with mutual respect. Both will attempt to be flexible and work to solve problems as they arise, excuse me. The respite provider agrees to work for the following amount, blank per hour, so $10 an hour, $15 an hour, whatever it is. And if the respite provider must cancel a respite service, as much notice as possible will be given to the caregiver, okay? So this is just kind of a simple agreement contract. You can get it notarized, do whatever you feel comfortable doing. But this, again, is just a good way to formalize the relationship and also to kind of give you and your respite provider a baseline of the expectation. So next, telephone screening of applicants. So screening potential providers is very helpful. Telephone screening can save time for both you and the applicant. So if you're screening through the telephone, it's important that you discuss important points of the job, right? This is what it is. I expect bathing, I expect feeding, I expect companionship, I expect whatever, okay? Find out the information about the applicant, right? Just kind of get a feel for who they are and what's driving them to this position, and get that first impression of the person, right? So some tips for screening on the telephone. Always trust your instinct and your gut reaction, okay? I know our culture likes to say, don't judge a book by its cover, okay? But sometimes you can just tell when they're not going to be a good fit, and that's okay. Trust that instinct. Be friendly and pleasant, right? I don't know why sometimes if you interview for a job and they can sometimes act annoyed that you're there, and it's like, didn't you want somebody to work here? So try to be friendly and pleasant. And it makes them feel more comfortable. Check to see if the person has reliable transportation and if getting to work on time is going to be a problem. If the applicant has a long commute, you'll want to know that that will not interfere with the job. So if you're in Madison County and you're hiring somebody who works in Decatur and they don't have a car, you might be running into some problems because there's no bus line that runs from Decatur to Madison, right? So that's a good way when you screen somebody that this is not a good candidate for me. Make sure you let the applicant know that you will need to do a criminal background check. And we'll talk about that a little bit more. Of course, you don't have to do the background check, right? There's no law saying you have to, but it is highly advised, okay, for obvious reasons. Discuss money and hours up front, right? If they are not able to accept the hours or the pay, now is the time to find out. There is no need to interview someone who already finds a job unacceptable, okay? So if you say, I can offer you $10 an hour and I expect you to come 4 hours a week, and they say, I don't want to do that for that little amount of money, okay, well now you know, right? And you can just move on to the next one. Giving a brief description of the job duties and if the pay and hours are already determined to be acceptable, okay? And set up a time to conduct a formal interview in person. So if you talk to somebody and you like the way they sound, you like the things that they have to say, they seem like they're going to be, the time is going to be appropriate for them, then you can move forward with a formal interview. So giving directions and your address to only those you choose to interview, right? Safety first. Or you might even just consider using a location other than your home if possible for the initial interview. You can just meet at the library, right? Because you don't know these people. Sometimes you do, but sometimes you don't, right? So it's just good to stay safe. If you're interviewing a stranger, so these are your interview strategies. Use common sense when setting up a face-to-face interview. Consider using a place other than your home for the interview. And prior to the interview, consider personal qualities you feel are important in a respite provider. So that would be, keep in mind your feelings about trustworthiness, honesty. Do you need them to have a sense of humor? Do you need them to have a good attitude or common interests of your loved one? How dependable are they? Excuse me. What is their ability to follow directions? And do they have good communication skills? So those are just some examples. But just kind of think about, what is your ideal respite provider's temperament going to be like? And that's why a phone screening is very useful, especially if you don't really have time to meet everybody for a formal interview. You can, maybe you have 5 people interested, you can screen it down to 1 or 2. Okay. And then that way you're not rushing out of the house to get these appointments or get these interviews done when you really don't have time to do it anyway. It's just a good way to kind of narrow it down before you take any additional time out of your day. So some tips for interviewing. Try to make the situation as comfortable as possible. You're interviewing, not interrogating, right? Explain the disability of your loved one to the extent that makes you comfortable. Provide for them a job description. Ask about jobs that they currently have or have had in the past, including any tasks that they performed and how they felt about those tasks. Did they like it? Did they not like it? And if the person is currently working, okay? And I think it's very important. There are a lot of people who are willing to do respite provision, but they do not have really the temperament for it, right? They want the paycheck, and that's fine, but you just have to make sure that you are comfortable with, their temperament, the way that they do things. And if they like the job or if they don't like the job, will definitely make a difference in the care that they are able to provide. Ask for at least 2 work references and explain how you will evaluate job performance. Again, you're trying to set them up for success, and clearly defined expectations are key for that, okay? You can take notes while you interview, especially if you're interviewing multiple people. You don't want to get anyone confused. Be cautious about hiring someone on the spot. Okay, sometimes you might run into somebody who has got a great personality. They're very charming. They say all the right things. You hire them and then they come in and they're a total dud, right? Like they know how to interview. That doesn't mean they're good for the job. Be sure to check all the references first before you hire somebody. Okay, so keep in mind as you check references that just as employers are limited in what they can ask a job applicant, they're also limited in what they can reveal about a current or former employee without written permission. So the only information that you can really legally obtain from a former employee is when they started working, when they stopped working, and if they're available for rehire. Okay, so you can't call an employer and be like, spill the tea, tell me all the dirt on this person, right? You can't even ask if they were fired. You just say, are they eligible to be rehired? And typically, if it's a no, that means that they were probably fired, or that their job performance was not satisfactory in some way, or they left without giving good notice, things like that. And so that can kind of, even though you can't get specifics, it'll at least give you an indication, and also to let you know if they're actually telling you the truth. They might say, well, I worked for Right at Home for 15 years, and then you call Right at Home and they say, I've never heard of this person. Well, then right there, you got you a dud, right? Let's see. So, and you will be surprised at what a voice can tell you regardless of the words. So if you say, well, hey, did Jane work with you for 6 months? And they're like, yeah, okay, well, what's that all about, right? So you can kind of get a little bit of information, even if they're not giving you a lot of specifics, just on the way that they sound or the tone of voice when they respond. So background checks. Background checks are highly advisable because you are inviting someone into your home, typically, and you are allowing someone to have unsupervised access to a vulnerable person in your home. So while we do not require background checks for anybody, if you're on our program and you hire somebody to come in as a provider, that is not a requirement that we have. But again, it is highly recommended, okay? So make sure that the person you're interviewing understands your need to conduct a criminal background check. So you must have permission of that person to do a background check, and you can find consent forms that are designed specifically for this through your local police department or DHR, Department of Human Resources. They'll typically have that. And the cost of doing a background search will vary depending on who does the search and how extensive it is. So for example, some police departments will charge you maybe $10 fee for it. That will just be searching their database or from the local county in which you live. However, remember that the information you will get depend on who does the search. So it may be worth the money to have a private company do the search for you. So a private company might charge you a little bit more, maybe typically between $20 and $50 for a statewide search. and even a little bit more if you want to do a national search, right? Maybe this person doesn't have any warrants active in Alabama, but maybe they were up there in Indiana causing trouble. You know, you never know. So a word to the wise, do not send the applicant to pick up the test results, okay? And you can also apply for a stipend from us to assist with conducting those background checks. So if the background check is something that you want to do, but you don't have the funds to cover it, let us know and we will help you pay for it, okay? And it's a very simple process. So how do you find a respite provider, right? This is the big question. Okay, I know what I want. I know what needs I need to have met, but I don't know where to find anybody. Well, there's some ways that you can be creative to find a respite provider. There's a variety of ways to advertise if the limited registry of respite providers in your area doesn't meet your needs. So you can, sometimes people still read the newspaper. So maybe you can put an ad in the newspaper. Maybe you can advertise in maybe caregiver Facebook groups, right? But here's some options that possibly could be helpful for you. I got these upside down. Okay, so I'll read it backwards. Okay, so churches or faith-based organizations, those are typically one of the first go-to resources for respite. Often they won't have somebody come to your home, but they may have respite nights or respite programs, day programs available. I have noticed that a lot of these church and faith-based programs that are consistent, like on a weekly or monthly basis, are typically for senior citizens or older adults, but there are some that will have respite nights for children as well. So, you just have to look and see what they have available for you. Nursing homes or assisted living facilities, sometimes respite providers will put their card on like a bulletin board, or if they have people that work at these agencies or these facilities that are looking for part-time work, they might want to come in on their off day and help you. So it's worth going in there and seeing what they have available. Going to a hospital or a university that has nursing, social work, education, or social work programs or vocational schools where maybe a lot of people are learning to go into the field of healthcare or geriatric care or special needs care, and they want the practice, right? And so that could be a good way for you to find people looking for work in respite. Rehabilitation centers, right? Again, maybe there's some staff there that are looking for extra work, or maybe they have volunteers that come in asking if they know anybody who's looking for a respite provider. Okay, so that could be a good resource for you. Financial aid offices at colleges, universities, tech schools, or similar places. Again, getting those young nursing students in, or those young education students coming in that want that lived experience and a little bit extra money, that could be a great resource. Healthcare agencies, social service agencies, local newsletters of support groups or disability group newsletters will sometimes have advertisements for respite providers. Local newspapers, agencies. So don't overlook any nonprofit or for-profit that might be able to screen or refer applicants. I'm not sure exactly what places like Children's Rehabilitation Services, or even, our umbrella company we're under the UCP umbrella, and we have physical therapists and things like that. So maybe there's somebody there that could come in and help. It doesn't have to just be within your current social group. Okay, you can find other people in some of these areas. And then, of course, word of mouth. I mean, maybe it is just putting something on Facebook. Hey, is anybody on my friends list interested in interviewing for, temporary help with respite? You might find somebody that, hey, yeah, I can come in on a Saturday every other week. That's not a big deal. You never know until you ask, right? And then also, if you live in the state of Alabama, which I'm assuming most of you do, you can go on our website and you can go to Access Caregiver Resources, and that'll give you a drop-down menu. And at the bottom, it says Community Respite Programs Database. And so this is a resource listed by county of low-cost or no-cost respite care providers in our area. of the state that you're aware of, that we are aware of. And I just realized there's a typo in there. I put stat instead of state, but y'all know what I'm trying to talk about. So this will be, a lot of it will be like community respite programs, faith-based respite programs. And for those of you who don't know, we actually have grants available to help people either create a respite program or expand a respite program. And those are all also on our database. So anyone that's going to be in that is not typically going to be a for-profit. So probably won't be Visiting Angels or Right at Home or anything like that. It'll be, you know, First Baptist on Main Street that has a respite, you know, that kind of thing. And so a lot of them are free or low cost. So, you know, maybe $10 for the afternoon, $20 for the afternoon, something like that. So that's just another way that you can look for. And of course, you know, some counties have more than others, but we are always adding to it. So if you have a low cost or no cost respite that you know about, let us know and we'll add it to the database. So creating a good work environment. I think this is important regardless of the work that's going to be done, but typically if you're dealing with a very sensitive and intimate caregiving type of role, you definitely want to make sure that that's a good work environment for everybody. Because we know that respite work generally does not pay well and doesn't really offer any benefits at all, really. I mean, you're not hiring somebody and offering them, you know, Blue Cross Blue Shield as part of their employment. So those who choose to work as a provider will often take the job for other rewards like personal satisfaction or a chance to work with people with disabilities and chronic illnesses, or just to help out other caregivers. A lot of times when somebody's caregiving journey has ended, they then become a resource for other caregivers through support or respite because they know how hard it is. And so they're not doing it for the money, they're doing it for their own personal fulfillment. So the work environment is one of the most important factors in keeping that provider. You should work to do what you can to create a work environment that will bring out the best in your provider. So maintaining positive attitudes and being satisfied with their work is essential for them to continue helping with the respite services. So good communication between you and your provider will enable both of you to get along better and be happier with the arrangement, okay? Again, if you're thinking somebody's coming in here because they need the money, typically with respite work, they can take or leave the money. And if you're making their work environment horrible, I'm not getting paid enough for this, and they'll leave. Okay, so you want to make sure that you are very positive with them. So offering praise for good or correct performances. Many individuals work just as hard for praise, and it is just as important as what you're able to pay them. So everyone wants to feel appreciated, needed, and valued. So you can even pull from your own resources and your own experiences, right? When you go through your daily work with your loved one, how often would you feel a bolster if somebody said something positive about what you're doing, right? If they gave you encouragement. So just treat them in that same way. When it is necessary to point out that you're displeased with something that they're doing or that they have done, it's important to remember to be open, honest, and to criticize the action, not the individual, okay? That's very important. We don't want to berate people, okay? Don't let small irritations build up until an angry outburst occurs. We all know this is good advice regardless of the situation. Anger that's vented after building up is often expressed in destructive ways, right? When we get that long fuse finally hits that TNT, it can be very, very destructive. So always make a point of discussing something that irritates you as soon as you can. Confrontation is not pleasant, but it is necessary, okay? And of course, respect your provider. Remember that they are a human being and would like to be treated in an honest, kind, and respectful and patient manner, the same way you would like to be treated. Okay. Next, talk to your provider and be open about making changes in the job description or compromise to alleviate a problem. So say somebody came in and they said, well, I'm okay with feeding. That's not a big deal. But then they get into the work and they realize it's not something that they're comfortable doing or that they can do, or maybe your loved one is being resistant and it's just making it difficult for them. Be willing to be flexible in that way. Maybe make sure that your loved one is fed before you leave and, you know, only leave for a couple hours or something like that. You know, be flexible. And terminate the agreement if the relationship is not working out. There are good ways and bad ways to accomplish this task if necessary, right? So it's just not working out. Maybe your loved one is pushing a lot of their buttons and they're not responding in a way that you think is appropriate. It's okay to say something. It's necessary to say something, but you don't have to come at them. You can just say, well, this isn't working out, right? There's good ways, good mature ways to handle that kind of stuff. So how to give praise and feedback to a respite provider. So giving praise is going to, of course, you don't want to be fake, right? You don't want to feel like you're just constantly kissing their butt the whole time, but be sincere, right? And don't say anything that you don't really mean. Give compliments often for good work performance. I have warned all of my coworkers that I'm a chronic complimenter. I literally cannot help it. And so it comes very natural to me, but it doesn't necessarily come natural for everybody. And so it's good to be intentional about that. Like I really liked how clean the house looked when I came back, or I really like how my loved one is always really happy and content after you leave, right? Not after you leave, like, oh, I'm glad they're gone, but like they were content after spending time, right? So you can make compliments like that. A two-step compliment would look like describing the situation or the event that you liked and tell what your feelings were when it happened and say you appreciate it or just say thank you, right? Giving constructive criticism, use criticism as a tool for sharing information with your partner or provider, not as a way to berate them, not as a way to be, an angry overlord. Okay, we're trying to create positive feelings for their work, right? And we also want to make sure that they're meeting your expectations. So criticism is necessary. Let's just make sure it's constructive. Remember that the whole idea is to help you take a break from full-time caregiving responsibilities, and you want them to perform to your expectations and continue providing respite for your benefit, okay? So I don't want you to feel like, well, this is the only respite provider I can find, so I just have to put up with whatever they offer. You don't. You can definitely make suggestions and corrections in a respectful and uplifting way. A three-step correction. So here's a nice little framework to kind of help you if you're not comfortable with correction or confrontation. So first, you can describe the situation or the event that you disliked, right? I didn't like how you left mom's shoes in the pathway to the bathroom because then when she gets on her walker, she might trip, right? Second, tell what your feeling was when it happened. It made me very worried that her safety was not being prioritized, right? And then third, state how you'd like to have it handled next time. In the future, I'd appreciate it if you would keep your shoes by the door so that they weren't out in the middle of the floor, right? Because it's a safety hazard. So again, like very valid, right? You can have valid concerns and express them in a way that's respectful, in a way that's a teachable moment, right? A learning experience for that person and not making them feel like, they're the worst provider ever because they made a mistake. So suggestions for giving correction. Give the feedback as soon as possible after the situation you disliked occurs, right? Don't wait 2 weeks and stew on it and then be like, oh, remember back in February when, right? Discuss only one incident at a time and try to not bring up things from the past. Again, if you're being very timely in your criticisms and very timely in your corrections, there shouldn't be things lingering in the past, right? You deal with them when you need to deal with them, and then you don't have to keep, stewing over it. Focus on the person's actions, not the person. Keep the discussion brief and to the point, and don't exaggerate or become emotional, right? Don't be like, you never do what I told you to do, right? And be aware of your tone of voice. So 30% of the messages that we send are through words, and the other 70% is through our body language, right? So that's the tone of voice, the inflection, the way you speak will definitely affect the way that your provider reacts. Now, I will say as a side note, as someone who has been, someone who's been socialized as a female, and we are told often to watch our tone. We don't want to be tone policed. I do understand that can be kind of a sore spot for some people. But you can still be very polite and kind and get your point across. You don't have to be angry or nasty to somebody. Okay. Let's see. Did I skip slides? No, sorry. I hit the wrong button, and so all my slides slid. Okay. So here's a little checklist for training your respite provider. Because again, you may have somebody coming into your space that is from a skilled agency, and they have a lot of skill sets that they're bringing to the table. However, they don't know your loved one. They don't know your expectations. They don't know your routines. So even if somebody's coming into this space as an expert, they still need training. And especially if they don't have any skill set, they don't have, maybe it's just, your sister is coming in and she's an accountant. She doesn't know any of this stuff. So it's good to have a training checklist. Again, this can be determined before you even put out the feelers for a respite provider. So you already have this ready to go. So the amount and type of training you'll need to give to your provider will depend on the specific needs of your loved one. Training a provider is based on your needs and will reduce confusion later. Again, we want to make sure that the people know what they're getting into, right? So begin by explaining the disability or the illness of your loved one in as much detail as you feel is necessary for your provider to understand what you need, and in regard to providing that respite service, right? You don't have to tell them, about all the stuff that has happened over the last 2 decades, right? You can just, let them know what's going on now and what they need to know, okay? Explain any technical words you might use and be as specific as possible. Sometimes, when people are giving like intravenous drugs or they're giving insulin and they say, well, we put the sharps in this container. They don't know what a sharp is, right? They don't know that you're talking about a needle. So make sure you're explaining those things to them if they don't know what that is. Emphasize anything related to safety or emergencies, right? So if there's a procedure other than to call 911, make sure they know what that is and how to utilize it appropriately, okay? If you have somebody who maybe has epilepsy or a seizure disorder, what do they need to know if the seizure occurs when you're not around, right? Just things like that. Give step-by-step instructions for any procedures your provider will be asked to help with. For example, eating or transferring, and emphasize the importance of doing the procedure in a certain way, right? Because you've gone through the rigmarole, right? You've done the trial and error, you've learned from your mistakes, so you know what works and what doesn't. So let them clue them in, right? Maybe if you have like a lift device that maybe is a little tricky, right? Show them the tricks on how to make that work. Next, never assume that your provider knows exactly what you mean. Whenever you explain a procedure, be sure to have that provider explain it back to you in their own words so that you know that they understood the instructions, okay? Be patient. Give them time to learn the routine. So no matter how many respite workers you have had in the past, it will be different with each one, okay? So you didn't become the world's best caregiver overnight, right? You had to have that learning point. You had to have that learning curve. And so, of course, within reason, right? You don't want somebody putting your loved one in danger, but allow them time to learn that routine. Try to put yourself in their place and be aware of their feelings as you train. Utilize the services of others to help with the training process if you can. So family members or former providers can be a great help when you're training a new provider. Do not correct or do not correct or confront your provider in front of others. So your public behavior reflects your effectiveness as a manager. So if something goes wrong and you're sitting there with your buddy and you're having a cup of coffee and the respite provider does something you don't like, you don't want to turn around and confront them or berate them in front of somebody else. Again, you're just trying to treat people with human dignity, right? Respect, because they are human beings, okay? And when it is necessary to dismiss the provider, make sure you state your reasons clearly without verbally attacking the provider, right? You're lazy, you're stupid, you're boring, you smell funny, whatever it is, right? We don't need to say all that, okay? And also it's good to remember that it is illegal to hold payment for services for any service that has been provided, no matter if you're dissatisfied with that service or not. So you just dismiss them and pay them, okay? Here's your money for the day, don't come back, okay? It can be very simple. If you do have to let someone go, try to do it in person, and not by text, email, or over the phone. I will say that is a nice professional tip. However, you also have to keep in mind your safety. So depending on the provision or the respite provider and depending on the circumstances, you might not feel comfortable doing a face-to-face firing, and that's okay, right? If you feel like they are very reactive or they're not a very stable emotionally person, yeah, send them an email, right? Don't have them meet you somewhere just so they can sock you in the face, okay? Hopefully that's never going to be the case, but you never know, right? So obviously just use your best judgment. Set up a time to discuss the matter and find out the true reason why a respite worker doesn't want to provide the services any longer if possible. So if they're saying, I don't want to work here anymore, you can find out, well, why, what's going on? How can I make this work for both of us, right? And of course, if they're a trash provider, you can just let them go. But if they're worth your time and you can do something to keep them, it's good to know what that could be. And if there's a legal challenge by either party, you may need to consult legal services prior to that meeting. So again, you know the situation, so just prep for it. And then remember to document the conversation in writing just for your records, putting the date, time, and location and any pertinent details of the event. Okay. Again, this is just kind of cover your own butt information. The likelihood of you ever needing that documentation is probably fairly low, but you might want to go ahead and have it just in case. So make sure you be like, well, I had to let Jane go because she was drinking alcohol while she was taking care of mom, right? That might not be something you're okay with. And so just make sure you have that information down. So that is the end of my information. We got about 15 minutes left. And so I do want to encourage conversation. Let me go and stop this. Some of this might be pretty obvious common sense stuff. Some of it might be brand new to you. Some of you might have some tips or some good experiences or maybe even some leads of respite provision. And so now's your time to share if you have any. Just either put in the chat or you can go ahead and unmute and just say what you need to say.
I did want to say that there are a few Facebook groups. I know I think one of them is Alabama Special Needs Nannies for children. And I've seen some for adults where just anybody that's looking for help or anybody that's certified to help just kind of list their skills and things like that. And there's 2 apps, and I cannot remember the name for like caregiver services. And I cannot remember the name because I'm not really handy with apps. So that's another thing. And then I wanted to kind of, you said when you were talking about like taking notes and when you have an issue with a respite provider, also like document dates and times and take photos. I know we had some issues with folks that are coming out and helping with my grandmother too. And we kind of had a struggle getting someone else out there and getting our concerns taken seriously. A lot of things were kind of just blown off by the state she was in and things like that. So I recommend if like it's an issue you think your loved one's being mishandled or